Hello. Today I'm going to add my comments on several things that I mentioned before on this channel, and I want to increase your understanding of some things that might affect what we call mental health, our state and the current state in psychiatry. That also has connection with something that artists are trying to vocalize and describe what is going on in society, and I think there is a connection there. So let's begin. So first of all, I just wanted to touch again on something that prominent Dutch psychiatrists described as the state in current affairs in psychiatry, and in general actually in healthcare system in Netherlands, but that also reflects to other Western countries who are having similar kinds of how they handle and approach mental health care issues. So one of the things is that we all see, both normal people who are not professionally dealing with that and psychiatrists and psychologists who are working with people who have that sort of problem, that something is really wrong. Because in last decade, in last years, and probably amplified by pandemic and the crises which are going one after another, you can see the sharp increase of number of people who are having varying mental health care issues. One of most prevalent is depression, and very close in numbers anxiety. And the thing is that during this pandemic we actually realized that healthcare system as it is simply not sustainable. It is not for everyone. We saw that in pandemic, because many people who had other issues couldn't get the help they needed. I'm not talking only about mental health care issues, I'm talking about cancer patients, people who had any kind of surgical intervention, etc., etc. But I'm not going to focus on pandemic. It's gone. It's already second thing after the current situation. The thing is that people started thinking whether this is something additional that changed in our society, in our approach to life, than simply DSM-5 or any kind of how professionals are actually figuring out that somebody really has a mental problem. What I found disturbing is that especially in very young kids and in teenagers, the number of suicides, the number of mental health care issues are really as never before. You might say that the number of people is bigger than ever before, but this is not the thing. I think that many people before me actually already commented on that, because if you're bombarded with idealistic and over-inflated picture, how should you look, how much you earn, how successful you would be, how productive you would be, you're automatically put in the rut. There is no way how you can lead normal life when we compare with all the values we should embrace if you want to really have clear mind and life without problems, should I say, in medical sense, and this is simply impossible. So there is another book published in Netherlands, which I find out through phenomenal Professor Van Os from Utrecht, who actually commented, the title of book, and I will put the link below, is "Who is Mad Here?" But the thing is, I really have an itch to ask the same question. Who is mad here? All those patients who are coming in big numbers to seek psychiatric help, or the society which is actually asking them to do something which is impossible, because they couldn't cope with all the conditions, with rising increased demands from society, from employer, you know, the framework they are living in, that they are simply giving up. And this is also in connection in how some people see the depression. For example, even in animals, like chimpanzees, animals who are living in groups and in a kind of social setting like we humans, they can also show some signs of depression. And those are usually individuals who are actually fed up with everything. And you know, this is a mechanism to say, oh, don't beat me anymore, I'm already beaten, just leave me alone, I just want to be quiet, I don't want to see anyone, I don't want to talk to anyone, I'm beaten. let me recuperate, let me recover. So this is basically the reason for depression. When you feel that you're already a failure, that you already did everything, that you don't have strength to fight against everything which is demanded from you, then you have depression. And you can see where I'm pointing to. If you have too high demands, which are close to impossible to meet, first you're working harder, you're trying to do 2 jobs or 3 jobs, or to lend more money and to satisfy the hunger for success, for material things, etc., 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 and in the end you're burned out. In the end, you have some psychiatric illness. So there is a clear connection between the two, of very high demands in society and the rise of mental health care issues. But in the current situation, our governments and our systems, which are led by those who are insurers in mental health care issues, we are sad that the care that we are providing is too expensive. What does that mean? That means that healthcare is no longer for everyone. For example, if you have a teenage child who needs urgent help on anorexia or bulimia or something like that, she's going to wait probably more than a year. She's in high risk of committing suicide meanwhile, but nobody cares. So I think that all that I touched upon now is actually giving you an impression that in this time after the crisis, when we had really time to think about our lives and to analyze some things and to see where we are, it is really right time to revolutionize the psychiatry, or at least approach to mental health, how we can perceive public image of it, how we are helping those people, and how we prevent very young people to get in that trap. Thank you for listening.